Hi, this is Jess Davis here at the Davis Adams Medical Malpractice Law Firm in Atlanta. And I want to talk for just a minute today about pediatric infection malpractice cases. These are cases we tend to see all too often, and they are heartbreaking. They are tragic. And they typically look something like this. A parent takes a small child to the pediatrician, or maybe to an ER or to an urgent care, and the symptoms look kind of like a cold, maybe. Maybe there's some fever, maybe there's an elevated heart rate. Um, and the provider says, well, some stuff's going around, probably a cold. But when that continues and the symptoms linger and the child's not really getting better on any consistent basis, and you go back to the provider, what we see a lot is just sort of continued dismissal of the symptoms as nothing serious. And a good lawyer friend of mine once sort of described it this way. It's like the fire department pulling up to a house and seeing smoke coming from the back and concluding, well, I bet they're having a cookout, and then just leaving. Well, maybe they're having a cookout. Maybe it's nothing to worry about. Maybe the back of the house is on fire. And that's why it's important for the fire people to get out and walk around and look and just confirm, yep, it's a cookout, no problem here, or this house is on fire. Sort of the same thing with doctors. Even if they think, wow, this appears to be a viral illness that's lingering, but you know what? Let's just run some labs. Let's check a white blood cell count. Let's see what's going on here. Maybe let's give a broad spectrum antibiotic of some sort while we're awaiting the lab results, just in case. What we see in case after case is small children either dying or having catastrophic, lifelong debilitating injuries as a result of infectious diseases that could have been and should have been caught and treated with routine antibiotics. We're seeing that not happen, and we're seeing kids suffer some tragic, tragic consequences. So a message to parents out there, and I'm one of them. If you've taken your kid to the doctor a couple of times and your kid's not getting better, don't be shy. Don't be embarrassed to ask hard questions and push on the providers a little bit and say, hey, what could this be? What's the worst case here? Should we consider that? So I hope this information is never relevant to you or your child. I hope you don't ever need it. And I hope you don't ever need us. I hope there's no reason to call a medical malpractice law firm. But if you need us, we are here. Thank you for watching. I appreciate your time. Take care.